This conference will now be recorded.
Hi, everybody. My name is Casey Conlon. I'm the Library Sustainability Coordinator at the Mid-Hudson Library System. I want to thank everybody for joining us. Just as a little note, if you didn't hear it already, we're trying to mute everybody just to keep the noise down and make sure everybody has a good experience. We want to talk today about the phased reopening plan template that we've been developing for member libraries to use as they start to consider how they're going to open their library and how they can do that safely. Library services are really important, and they're going to be really important to help everybody get back on their feet in our communities. Our communities have taken a huge hit economically and just emotionally, and in many different ways. Our schools are closed, and we're going to need to band together, and we're going to need the help from the library to actually be able to get everybody back on their feet and to get our communities back in shape. So these services are important, but we also want to do this safely. We want to consider this the health and safety of our staff as well as the people in our community as we start to bring these services back. So what we've done is we've looked at a lot of the documentation that's out there, and we've tried to find really authoritative things, and we've looked at all the guidance that comes out. And I will tell you that we were looking at the guidance that came out yesterday from New York State about how to do curbside pickup for retail. So this is hot off the presses, this information that we have for you today. So we put that information together and we saw where it makes sense for libraries and what needs to be fleshed out a little bit more, or where there might be questions, and where we could provide answers in these documents, we did. Um, Anything in these documents, in the document that we'll share later today, it is up to your library to review it and make sure that it complies with local laws and federal laws. And keep in mind as well that things are changing. As I said, we got documentation yesterday with guidelines on how to do curbside retail service, and the New York pause actually expired at 12 a.m. this morning on Friday morning. So there wasn't a lot of room there for people to figure that out. Our region is still not opening up or reopening as some other regions in New York State are, but it's not a bad time to start thinking now as we get closer to being able to do that, as more people are not being infected with COVID-19 due to the social distancing we put in place, and as more and more controls are put in place by different local authorities that help mitigate the spread and the risk of COVID-19, including contact tracers. So this plan will be your foundation, and you will build on it and you will make it your own. It does have a lot of answers. I think one of the things I love doing at Mid-Hudson, and one of the things Mid-Hudson does really well, I think, is saving a lot of work for 66 libraries. And so rather than have 66 people make up their own document, maybe we give everybody a head start and they have, again, this foundation, and they start building their own library services on this document. There will be updates. You should look out for updates as well. We're learning things about COVID-19 all the time, every day. The governor does a press conference every day. We do a director's briefing every week because and new information is always coming out. So I can't stress that enough, that we want to all keep an eye out on for new information. Mid-Hudson, we're going to be sharing stuff as often as we can to make sure that you are in the loop. And we will be doing another webinar similar to this as we learn more. And we will be providing updates to this document too, and we'll put it in the context of this document where that's helpful. So today we're going to go over the phased service levels that we were thinking made sense for libraries to enact as we move forward, and talk about some of the guidance that we've gotten from authorities. Again, some of those answers that are out there. There are not answers to every question that we have, unfortunately, and things are changing. And then we'll look a little bit at the best practices that come from from the authorities and from that guidance. But first, just so we can all get acquainted a little bit, if you haven't taken out your phone already to look at Instagram or to do some shopping, please take it out now and go to menti.com. And when you get to menti.com, it'll ask you for a code, and you're going to want to put in this code 10715. So 100715. And when you go there, you can answer this question for us, and we will get an idea. I want to hear, what do you miss most about your library building? The library is very much open, and the library is very much still a part of all of our lives, of course, all of us here and many of our communities. And I want to see, what do you miss the most about the libraries? Is it the smell of the books? Is it those little patrons who come in who, love to sing songs? Is it checking out books, whether they're your own books or if you just love using the scanner? The code is right on the screen if you missed it the first time around. It's at the very top. It's 100715. If you love the big patrons the most, that's a thing. They're great people too. Always, 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 our patrons are very appreciative of us. I left my coffee mug at work. I miss that some days. I do have mugs here, but it's not the same as the mug that I brought to work, definitely. All right. Hold on a second. We are having a couple of technical difficulties. I'm going to stop sharing my screen for a minute and then start again. Okay, so let's see. All right, so I think that you should be seeing this now. This is a graph. I apologize for that. Um, so I just wanted to thank you very much for the people who let me know about this. I'm very sorry. So anyway, so this is just a fun way for us to just kind of, get acquainted a little bit and see what's going on out there. It's very hard to do these webinars and not be able to see everybody. That's one of the most fun parts about doing the webinars, or to do an education like we do at Mid-Hudson, is to be able to get to see everybody and talk to everybody and interact with everybody. It seems like people miss a lot of stuff about their library, and some people left some stuff behind, just like me. So the next one that we're going to try to do is we're going to try to move on to, I'm interested in hearing when you plan to reopen your building. And so you should be able to see now the new question. And I'm interested in hearing when everybody is thinking about reopening. The plan that we designed can be adapted to whenever you plan to do these things, but just a little idea of when everybody plans to get back in that building and start doing some of these services. Okay, a lot of people are feeling like phase 4 of the New York program is when they want to open. We have some people looking to do it soon. Okay, a lot of phase 4, a lot of phase 2. Okay, all right, so that's interesting. It's pretty even split between, or not even split. Phase 4 is winning, but phase 2 is holding its own, and some folks are looking at opening in phase 3. And there are definitely a decent amount of people who want to open up very soon. So when we think about opening back up, we want to think about first is New York State has given us guidance. They have released recent guidance, and New York State is giving guidance to the regional guidance for the local authorities and the local regional control rooms, who will make decisions about how you open. We've seen some of the documentation and heard some things from some of the counties about what will happen with that, but no county or region is really supposed to open before they have met these metrics. And Mid-Hudson is split across 2 regions. We cover both the capital region and the Mid-Hudson region. And you'll see that as of early this morning, neither of those has hit all of the marks, all of the 7 metrics that they need to hit to be able to reopen. So we're still waiting for guidance from the state. We're still waiting for approval from the state for both of our regions to be able to reopen. And when that comes, we'll want to have our plans ready, and we'll want to think about the stuff that we're going to do and the services that we're going to provide to our community. So the phases of reopening from the state look like this. Stay-at-home orders, which is where we're at right now. That's just essential businesses. You'll see restaurants doing some work and construction. Phase 1 is curbside retail has been called out. There's a number of things in phase 1. These are the most relevant things that apply, I think, or could be applicable, the ideas behind them to the library services that we can offer. In phase 2, retail and professional services will open up. In phase 3, restaurants and hotels. We'll see people sitting in restaurants then at phase 3 if all goes as planned. And in phase 4, arts and recreation and entertainment and education will start to open up again. All of these things will likely look very different from what we're used to today, but they will be permitted to reopen. As of right now, these places should not be open unless they fit in, unless they're in, upstate New York where they have opened with phase 1, and today is the first day that they're able to do that, or they are an essential business. So we tried to think about some of the library services that we could offer, and this is independent of the phases of that the New York State government is offering, or that is the New York State is providing for us. This is going to, again, be local to your library. We saw a number of libraries who are thinking about opening in phase 4. Some were thinking about phase 2, and some are thinking about soon. Of course, how soon you get to open is dictated by local authorities and New York State and other relevant authorities who can tell you whether your business can open or not. So we tried to break it into different levels. At level A, we have where we're at right now, which is that our buildings are closed, but our libraries are open, of course, and we have online services, and a lot of our staff are working really hard to connect with our patrons. The next level that we could see coming up, and it might be considered with the retail curbside, we'll wait if we get more information from the state government or from local authorities about libraries specifically, we can slot that into here. But we imagine that given the guidance and guidelines that we've seen, libraries can safely do curbside pickup. Of course, at this stage, patrons would not be in the building. And the reason that some of these things are broken up so much is that libraries aren't just one thing. There's many businesses and industries that do one thing, and they would neatly fit into, one of the phases that the government has provided. But there's not a lot of organizations in town who, are both an educational institution and also a place that people can come and use the computers. Anybody can walk in and use a computer, and people can borrow whatever books or materials that they might want, everything from a video game to a museum pass or to virtual reality goggles. So it's hard to document all of that, so we're trying to think of the different phases or the different levels of service the libraries could provide, given some support from local authorities and from state guidelines. So the most important level right now, especially as the other stuff comes into focus later on, is going to be curbside pickup. So in any of these phases, curbside pickup, or which is level B or level C or level D or level E, we're going to want to make sure that we do things safely. Level C, we would introduce, again, it's up to you, it's your library's call. We'd introduce the CERC desk. People might be able to come in and access the CERC desk if retail has been approved, and they might be able to browse the stacks. Browsing the stacks at that point might be similar to your experience of going to the food store right now. You're gonna want to have a lot of hand sanitizer out for folks probably. And getting people access to our public computers is gonna be important because there are many, many people who do not have computers at home or do not have internet at home. There are many children who are struggling to keep up with their peers in education because they don't have the equipment they have at home. I know my family, I'm very fortunate. I had a laptop laying around, and it took even a cell phone too, so that Goldie can take a picture of her computer, as my daughter's in 4th grade, to be able to take a picture of her computer and then upload it and interact with Google Classroom. I can't imagine if I didn't have a computer to both do my work and have my wife do her work and my daughter do her work. But that is the situation that many people find themselves in. So, as soon as we can get our computers back in people's hands, there will be, of course, emergency services that people are going to want to access, as well as applying for jobs. There's going to be businesses looking for people, and there's going to be people looking for work. We know that unemployment is a huge issue right now. So at level D, as things open up a little bit more, we'll provide access to our study areas and allow people to be there and using computers in that time. And at level E, we'll introduce programming, and that'll be a pretty open phase as far as we know it. And all of the caveats that go with this is that we would follow guidelines, and I imagine programming would be a little bit different than what we're used to, and people would have to be social distance. So I'm not sure that all the programs that we're used to having would always work. So as we think about how we're going to actually do this, we want to keep in mind, just mitigating the risk wherever possible. This comes from the National Institute of Occupational Safety and Health. This is the hierarchy of controls for keeping people safe and reducing risk. So eliminating the risk, that's where we're at right now. And now we're moving into, as we start to think about doing curbside pickup, we're thinking about engineering controls. We're thinking about physical barriers would be engineering controls that keep people from, being able to actually, expel the droplets, or interact with our staff and our patrons. It would keep them separate. The other thing that we're going to think about a lot is administrative controls, things like social distancing and limiting the number of staff who are in the building and making sure that staff have training on how to best interact with patrons and operate in the building. The last line of defense, but still a line of defense, is PPE, is personal protective equipment. And that is something that we're gonna wanna make sure that we have for our staff and that our staff will understand the limitations of PPE and how to use PPE and how to, avoid, uh, you know, injuring themselves, posing risk to themselves when taking off or putting on PPE. So we're going to look for training on that. We actually, in the documentation, we have links to resources that I think are good for training for staff. They're online and they're free. Some of them are really fast, some of them take a little bit longer. So this is just a quick look at the document. It's about 5 pages per service level of library service. I'm not going to go through the document right here, right now, but you'll see we have a little preamble about what we're doing in this phase, and then we go into some of the considerations, which we'll talk about a little bit later, for how we enter this phase and this service, this level of library service. And there are footnotes in the document, and these footnotes either denote wherever we have found an authoritative resource on how we should provide these or why we must provide these according to guidelines that have been given to us, or an example of how you can do this, or suggestions of how you can do this. So this is what the document looks like, and we'll be sharing this out later today with everybody. And again, it's yours. It'll be in a Microsoft Word document, so you'll be able to put the stuff that you need to put in here. You'll be able to delete things and add things. If you have questions, we're happy to answer your questions. So at the beginning of every section, there is considerations for each level. The number one thing that you're going to want to do is appoint a COVID-19 coordinator. And this is most likely going to be the library director. So the other thing that we have at the top of each section is facility preparations. And for facility preparations, we want to make sure that you have the disinfectants and cleaners that you're going to need. And I think this is a good thing to go through at the beginning. At Mid-Hudson, we have our staff is going through what it takes to actually clean and disinfect all the different surfaces. And when you consider how much materials and how much time actually goes into disinfecting a surface, it makes you realize that limiting the number of staff that are in the building is a very practical thing to do, because it takes a long time to clean things. I don't know if anybody's been watching the news, but when you disinfect something, you're supposed to follow the directions that are on the disinfectant. And many disinfectant, I feel like for a long time, we all got away with just wiping it down super fast and using one wipe on an entire house or entire room for a disinfectant wipe, but that's not how we're disinfecting things now. You have to let the surface has to be wet with a disinfectant for a certain amount of time that's on the bottle. And so when you factor that in, it takes a lot longer to clean things than you might, than maybe that you think you can do if you're a really fast cleaner. The other thing that we have at the top of every section is the personal protective equipment. This is the last line of defense, and sometimes the first line of defense for staff to not infect other staff or to not become infected by other staff with COVID-19, and to also protect patrons and to protect staff from patrons. We also have policy. We're gathering policy as we can find it for the different areas of library service that you're going to have policy related to. We have some questions about whether you can make one policy that encompasses them all, and in many cases, we think that you can. So the other thing to think about at each service level is procedure, how you're going to do different things. In many cases, as you're going through the facility preparations, you're going to see that this isn't business as usual. We're the library, we're pretty cool. People come in, they get to do whatever they want a lot of times, as long as it's within reason. But now we're gonna have some more rules, and we're gonna have to make sure that the staff know the rules, how the staff can enforce the rules. And what the rules are for the staff as well. So the other part of this is the staff. At the beginning of every section, we'll talk about the staff and what you need to do for staff training and what staff will be doing and what the expectations are for staff. A lot of the guidance is very protective of staff. I think our libraries would have already been very protective of their staff, but I'm glad that the guidance has up front the different things that you have to do to make sure that your staff is going to be okay or give them the best shot at staying safe. So these are the service areas that we identified for each level that we wanted our library trustees, directors, library staff to be thinking over as they consider their service at that level. The facilities, as we mentioned, circulation, checking in, checking out, holds, delivery, communications with your community and with your staff, library programming, whether you're doing it or not, how you're going to do it, governance of the library, in particular Board of Trustees meetings, whether you're doing outreach into the community and what that looks like. Hopefully we're all still doing outreach, but it's probably a lot different than it used to be. Probably not a lot of people at PTA meetings, and there probably aren't a lot of PTA meetings right now. Whether your library offers home delivery, and this is in the context of a home delivery service for homebound patrons. That's the context that this is written in. Bookmobiles might seem a little bit silly, but some people are finding some innovative ways out there to bring resources and internet service out to their community. So we wanted to touch on that a little bit. We also consider study areas, and maybe you would call them work areas for library patrons, and how you can set up social distancing in those areas, how often you want to disinfect those areas. We also go into public computers. This is obviously a huge deal. Our public computers are probably a tough thing to manage even on a good day, but throw in a very contagious virus and they become a lot more difficult to manage. We've also looked at internet access in the context of public Wi-Fi and offering it when you would not offer it from your building, in case it was causing a problem with people who are gathering at the library, as well as tech help. We all know that a lot of people come into the library and they need help with their phones. And when can we offer that service? That's a very personal, very close service. So in terms of facilities, we look at a cleaning schedule as well. One of the pieces of good news I thought was that the documentation that comes from the CDC and from New York recommends that if nobody has been in your building in 7 days, then it is not necessary to do a deep clean of the library because, and they say explicitly, because the virus cannot live that long. You can read a lot of things out there on the internet, but this is the information from the CDC. So if you're considering a deep cleaning, or if you got a really high ticket for a price tag, that kind of deep cleaning would not be called for according to the CDC and according to guidance from New York. When you're considering cleaning as well, consider high traffic areas. High traffic areas are doorknobs, switch plates, push plates, anything that people are touching a lot, both in staff areas and in patron areas. And this is where we'll get into, if your library building is closed to patrons, then you probably have cut down on the number of switches and doorknobs that you have to clean. So, again, being strategic about how we reopen our buildings and use the supplies and resources that we have. Restrooms are considered a high traffic area. And one piece of documentation that we saw, it comes from the New York State, and it's what they recommend. The guidelines that they provide recommend cleaning restrooms once a day or more frequently. So, that's just something to keep in mind. If you're going to be open, you should be cleaning your restrooms once a day. There might be a little bit of wiggle room, but that was the number that I had seen. The other thing that's interesting that might be not part of your process now that you're going to want to do is the guidelines call for having a cleaning log. And so a cleaning log, you'll have to, I think a lot of larger institutions do this. I think sometimes if you go in the bathroom at like the New York State Thruway, sometimes you'll spy one of these and the person ticks off the different things that they cleaned and then they initial next to it with the date and the time. And so you're going to want to maintain this. This is one of the guidelines that New York State has put in place. In terms of your facility, you're also going to want to post some signage, both for staff and for patrons. But as we start out, you're going to want to post it for staff. You're just going to want to be reminding people all the time about social distancing, hand washing, and how to use that PPE and when to have it on. The other thing that you want to consider is disinfectants and cleaners. I know they're hard to source. There is a large list of cleaners from the EPA that are believed to and likely to combat the COVID-19 and the coronavirus, and that is linked to in the document. It's called List N. You may have seen it elsewhere already. The other thing that we have to do with our facilities is reduce the occupancy to 50%. So you're gonna wanna keep an eye out. It might not be a big deal as we move into curbside pickup, but you're gonna wanna keep this 50% number in mind. This applies to areas and your building. So you don't want more than a normal 50% occupancy rate for your building, including patrons who might come in. Obviously, that's for a little bit later on if you're not having patrons in your building. The other thing that you want to start putting in place is social distancing markers. These can be as simple as a big piece of blue painter's tape on the floor. Think about if you had a fight with your brother or sister or something and you wanted to call one side of the room and you don't want them to come over on this side, that's your staff don't have to fight, but those are the lines that you need to put on the floor to let staff know how they can stay separate from each other. This is also going to be important as you get into interacting with customers. If you've been out in the world, if you've been food shopping, you may have seen some of these things in place. You can have signs on the floor, and we link to some signage templates that you can use. But even a simple piece of tape just to let people know the line that they're supposed to wait behind so that they know what 6 feet is. The other thing that we can get into as we think about the facilities, and if you have access to resources to create these, are physical barriers. These are kind of like sneeze guards, or if you think about the liquor store down in the city or one of the old MTA toll, the ticket taker booths where you buy like the subway tokens. They got the glass partition so that you can't get into that booth with that person who's selling you liquor. In this case, we just don't want droplets going from staff to patrons or from patrons to staff. And likewise, you might have physical barriers set up in staff work areas so that staff aren't passing droplets back and forth to each other. One of the things that we see in the documentation as well, and you may want to consult some of your HVAC experts, is ventilation. You want to increase ventilation where possible. This is something that is recommended by the CDC and the New York State, and this will help mitigate the spread of the virus. But again, I wouldn't go tinkering with your AC system. I would call somebody or see if you can open some windows to maximize the air that's moving or coming through the building. The other thing is hand washing, and I thought it was of note. I know we're all probably aware of hand washing, right? But they do say explicitly in the New York State documentation that you need to provide paper hand towels for people who are washing their hands, which may be of interest to you if you only have hand dryers. So these are some of the things to think about as you consider like opening your facility. We've provided, sample statements of what you can say about this in the template. Move them around as you need to. Define how often you're going to clean things based on your capacity of your staff and how many people that you have, or how much disinfectant, how many resources you have in that way. A little note about PPE. Sometimes there's questions about whether a cloth mask is acceptable, and yes, a cloth mask is acceptable. In this case, the library should supply a mask to library employees. This does not preclude a library employee from bringing their own mask, but the library should provide a mask, and they should also provide training. We see training down at the bottom, but we should provide training on how to clean the masks, and the mask should be cleaned after every shift, or discarded if you provide disposable masks. But if you can provide a reusable cloth mask. And the mask does not have to be worn if you are not within 6 feet of a patron or another staff member. But the documentation from New York State does say specifically that if you need to be ready, almost like it's some kind of like contest, or you're gonna surprise somebody, that this person has to be able to put on their mask really fast if somebody does come within 6 feet of them. That's not a good game to play at the library, but that's just something to keep in mind, that you don't have to wear the mask all the time when you're in the building if you are not symptomatic. But you want to be able to put on that mask quickly, and the library should provide the mask to staff. There's also just a quick note: if somebody has a condition wherein they can't wear a mask, then they would not be required to wear a mask. The other thing that we call for in some of the guidelines that we have is waterproof gloves, and I think gloves are going to help a little bit with disinfecting. There will be a lot of disinfecting, even if you're not scrubbing down your whole building every day. There will be regular disinfecting of workstations likely. as part of your plan for restoring services to the community. So we have videos from the CDC about donning and doffing PPE, which in most of our cases is going to be face masks and gloves. You should also have guidance specific to the PPE as I mentioned before. If there's specific cleaning or cleaning frequency that you want staff to observe with cleaning their cloth mask, then you'll want to let them know about that and make sure that they're aware. These are some of the policies that are likely going to need to be in place as you look to open your building. Many of us have got the pandemic policy in place. If you don't have a telecommuting policy in place, you may want to put one in place that outlines how and when it's appropriate for staff to telecommute. A lot of the guidance that we're seeing, I'm sorry to keep saying guidance, a lot of the things that we see say that people should continue telecommuting where possible. So the idea is to mitigate risk. And remember, we're talking about 50% building occupancy. So if somebody doesn't have to come into the building to do their job, then they probably shouldn't. You should probably let them stay at home, and that will reduce the risk of them catching something. It'll also reduce the risk of them spreading something to other people in the building and patrons. So think about a telecommuting policy. A proactive infection plan we'll talk a little bit about later. We're still trying to parse exactly some of the things that they've written in here. But we'll talk about that a little bit later. Emergency sick leave, if you haven't done this already, you're going to want to, as part of the proactive infection plan and as part of just safety in general, you're going to want people who are symptomatic or sick to not come into work. That's part of the idea behind this is, if they're sick, you don't want them at work making other people sick. This is a deadly disease, or it's a deadly virus. Patron conduct. This might be something if you want to talk about whether whether people coming to the library will be required to wear a mask or not, how much time people are spending on the computer will come in with computer use, and meeting room use. You might want to include in your meeting room use policy things about social distancing and who can use the building in this very, very tough time that we're going through. So we have a little bit of guidance in here on materials handling. We recommend, based on, you'll see in the lower right there, the Northeast Document Conservation Center and the WHO have both said that the virus can live on plastic, like the plastic that's on our books or DVDs, for 72 hours. So if libraries have space and they choose to do so, they can quarantine materials that come in for patrons or from Mid-Hudson Delivery for 72 hours. And this would be long enough for the virus to likely die or not be infectious on those materials. This is coming from the Northeast Document Conservation Center and the WHO. You can quarantine items in plastic bags is one of the recommendations they have. You can quarantine them in boxes. You just want to put them somewhere that they're not high traffic and people aren't interacting with them too much. And quarantining them, again, will limit the risk of exposure for staff who are handling materials. It's worth noting that many people who observe good procedure are not becoming infected with this virus. A lot of the people who are on the front lines from antibody testing and showing that they're not actually being infected with the virus because they're observing the procedure, wearing the correct PPE, using social distancing when they can. The protective equipment that we recommend for handling materials is gloves and masks, and that again comes from the Document Conservation Center. All right, curbside pickup. This is likely the first place that your library will start providing services to the community. This is the option that we see opening up for retail in phase 1 of the state's phased reopening plan. As part of curbside pickup, if you haven't been out there, if you haven't been to a restaurant to pick up a pizza or something, there's not a lot of restaurants open right now, I think, besides Pizza Down by me. but you're going to want to have some kind of signage for the process of how people are going to pick up these materials. How are they going to request them? What are they supposed to do? Where are they supposed to stand? What kind of services are available? What are the hours? So, you know, a nice big sign, a nice big like A-frame sign that people can read from a parking spot or get out and read would be good. The other thing that you're gonna want to include for curbside pickup is social distance markers, both for staff, so that staff can be back from the patrons if there's any kind of exchange. If there's like a common point that staff and patrons are going to interact with, you want to keep them separate wherever possible, so that they're not in the same 6-foot area, defying the social distancing whenever they have a chance. The other thing that you're going to want is PPE for the staff. Remember, anytime you're within 6 feet of somebody, you should have a mask on. You're required to have a mask on. Gloves probably wouldn't hurt as well here. And going back to the idea of social distancing, you're going to want to avoid a direct handoff is the term that they use. So, as much as we love seeing our patrons and interacting with our patrons, we're not going to want to give them books directly, because that's going to increase the risk of us as the library employees and of the patrons. We're also going to want to disinfect surfaces that patrons and we as library staff are interacting with frequently, preferably after each interaction. And we're also going to reduce the staff handling of an item. And the way to think about the staff handling is, if you're getting books together for somebody, limit the number of people who are getting the books together and bringing the books out. That way, the number of people who are actually touching this book and potentially contaminating it or getting an infection on it are limited, both for, again, the staff and the patron. When you have more people handling it, the risk goes up. So, maybe it's one person who pulls the book or grabs the book and then walks it out there if possible. It's not one person grabs the book, puts it over here, another person grabs it and brings it out to the patron, whether it's to their car or to a table outside. So limiting the number of staff handling the items that you're providing. So the other thing I think to think about with curbside pickup is the actual logistics of how people are going to pick up books. We have lots of different libraries, many different size libraries, many different facilities in the Mid-Hudson library system. So there's no super prescriptive way to do this. You're going to want to observe that social distancing that we talked about whenever possible. You can do that by putting things right in somebody's trunk. We have some libraries who are thinking about getting lockers. That's a really cool idea, I think. But you could even do it with a table outside, right? And you can put the books on the table and the person can come up and get the books. And that way you don't have to actually hand the books to somebody. There's, a number of ways that you can do this. Whether you need to schedule this or whether people call ahead, again, I think this is going to be based on your library and the size of your library. There's one of our libraries, at least, and I think a couple are interested, is going to get an app, and this app will do a lot of the checkout for the process and actually have scheduling times for people to come and pick up their materials that they've requested. But I put up good old pencil and paper here because where there's a will, there's a way. And based on, your resources for purchasing apps or your staff's time or your staff's ability with different programs or apps, you may just want to go with a pencil and paper. That may be enough to actually, deliver this service that you're trying to deliver. Scheduling might be accomplished that way. So again, keeping in mind that you're whatever means you figure out, you want to keep in mind the principles of not doing the direct handoff and maintaining the social distancing wherever possible. There are explicit mandatory things in the guidelines that will be included in the template plan that we give you, but they are, they're not so explicit as to what you actually have to do and how you do it. You'll want to describe how you're going to do it and have a procedure. But that is up to you. It is flexible enough for you to figure out how you're going to do this. So when you think about doing something like this, we think about our staff. Our staff have to do it. And this is a new thing. All these things are going to be very new for staff. So whatever new procedures you come up with, and as you come up with these new procedures, you're going to want to make sure that staff are aware of them so that they have a chance to be safe and to keep the patrons safe. At this point, we're going to be thinking again about the curbside procedures and just doing the basic tasks of doing that curbside or whatever you're doing in the library, whether it's processing materials or checking in books. A lot of times checking in books is kind of a social activity, I think. I remember, you sit next to somebody else, you got the two computers right there, you're chatting, you're pulling out of the same bin. That's not going to be a great procedure at this point. That's going to be a risky procedure. So you're going to want to train staff on how you expect them to do this and work out what's actually going to work and make sure that they know what you expect and how this is supposed to work. Also, keeping in mind, if it's not working, you have to hear from them and you have to be able to design something that's going to keep them safe. Again, we mentioned before, you want to do a little bit of training on PPE for staff that's relevant to the PPE and general for PPE. And the NIOSH course, the National Institute of Occupational and Safety Health course. I took this and I thought it was pretty informative, even though I think that I've read a lot about COVID-19 at this point and different kinds of safety. This is a good course and I think that all staff should take it. It doesn't take up too much time and I think it is a good thing to provide to your staff. The other thing to remember is communication. Whatever it is that you're doing, make sure that your staff know that you're doing it and what you expect of them. There's a lot going on here and a lot changing. I think, don't be stingy with that send button. Make sure staff are in the loop. Whenever you can communicate with them clearly, obviously do so. But don't be shy about sharing information with staff and making sure that they have the most up-to-date information on what the library is trying to do. I had some people were asking what the apps were. We are going to review them, I believe, later today or very soon about the different apps that are available. Lori is looking into them for us, Lori Shedrick, and she will provide us with some information, I think, on pricing and about how they function. And library directors will be able to make a decision about whether they want to implement that app at the library. It is not like a free app that you could use. I'm sorry if I was misleading there. It is a strict library app that interacts with the Sierra API, which is super fancy computers talking to each other. So look out for more info on that. Again, we're sharing stuff as we come into it, as we get more information. The proactive infection plan is something that you need to have in place as you begin to open your business, your library in this case. Okay, so in part of the proactive infection plan, we're going to be screening our library employees. This is required. Daily screening is required. A little bit of how to screen people. There's a couple ways to do it. You want to make sure you observe the OSHA standards so that you're not violating anybody's rights and not doing undue medical examinations on somebody. This is something you need to be cognizant of. But it can be as simple as self-reporting, and this can be done by phone or by web form remotely. Obviously, that's ideal in many ways because you wouldn't want somebody who is symptomatic to come to the library and tell you as part of the exam, like, oh, by the way, I have a fever and I have aches and I've lost my sense of taste recently. Because at that point, you'll probably tell them to go home and you probably wish they hadn't come in. You are permitted to take people's temperature as well as part of this, but you do not have to take people's temperature. I think that's good to know. The other part about this is who are you going to be screening? And in this case, we recommend screening staff and essential visitors. Essential visitors here, essential visitors, essential is the word. Essential visitors means people who are coming into the library who you need to come into the library, maybe performers, maybe a plumber. Essential visitors explicitly does not mean customers, so it does not mean patrons. So we're not going to be screening patrons. The other part of the proactive infection plan and the other thing that comes from the guidance from New York is that the screenings must be reviewed daily and you must record that you reviewed them daily. And in this case, it's going to go back to that COVID-19 coordinator. It's going to be the library director, ideally, or a human resources person who will review the record. and keep a record of their review, who will review the screenings and keep a record that they have reviewed them. This is a requirement from the state guidelines. And this goes into a little bit with tracking, because we want to know, the state wants to know, and they want to be able to track when people get sick so that we can track down who's sick and who they may have had contact with. So in your proactive infection plan, you also want to do a couple of things based on when you do find somebody who may be sick. And I hope that none of us find anybody who might be sick, but it might happen, so we need to prepare for it, and so we need to have it be part of our plan. So if somebody comes in and they report that they have symptoms, or if they report that they tested positive for COVID-19, then that person will either be sent home or they will be required to stay home. The other thing that you'll be doing at that point when you find out that this person is tested positive or symptomatic is you're going to report this to your local health authority. And again, that's to aid them in tracking this. This person will not be able to come back to work until they have completed a 14-day self-quarantine. And this comes from the guidance again. If you found this person was sick while they were at work, or if they were at work recently and they reported that they were sick, you need to clean the areas that they were in. So the first thing that you do is you close the area that they're in. It is not required that you close the entire facility. If you can close the area and clean the area. You want to open any windows. Again, that goes back to the ventilation that we were talking about earlier today. You'll also want to wait 24 hours, but that is if possible. So if you can close an area for 24 hours and open the windows, that will mitigate some of the virus that's left in the room, and you'll be able to go in then and be a little bit safer as you move to clean and disinfect the surface that the person was in contact with. So that's just a real quick look at the proactive infection plan. We're still trying to work out some of the details on that one because it was released yesterday, and that is a big deal. We want to screen so we can keep everybody safe, but we also want to make sure that we're respecting everybody's rights to the confidentiality of their medical information. All right, so these are a couple miscellaneous things that came out of the guidance that we got yesterday. So you will have to affirm that you reviewed and understood the guidelines. And so we'll have a link to the guidelines so you can read them over. It's about 11 pages. Like I said, we're going to synthesize a lot of the information that we can into the template for you. And the other thing that you want to do, which you're probably not used to, is maintain a log of staff, which shouldn't be too hard if you have timesheets or if you have a clock, electronic clock procedure. That shouldn't be too bad. And also log essential visitors. So remember, keep in mind, this is not patrons. We're not logging all the patrons who came in. We're logging the essential visitors. So if a plumber came in, and this is for the visitors' protection as much as it is for the library's protection. If the visitor, or if somebody comes to do some plumbing at your library and you find out that the staff was sick, that person might want to know so that they can go get tested, or so that they don't, harm anybody that they know, or so that they're not going around and spreading the virus. I see really fast just on the chat, somebody was asking about UPS man, and it says that if deliveries are done with PPE, that you don't have to worry about logging them as essential visitors. But if you do have a regular UPS guy, it might not hurt, UPS man or woman, it may not hurt to get their contact info. Again, this is for their protection as much as it is for the library's protection. All right, so I wasn't watching the chat box too hard, but if we do have any questions, I'll take a look at some of them.
So Casey, a little further back, we did have a question about why it's 72 hours for materials, but 7 days for surfaces when it comes to safety issues.
I can tell you that this is the documentation that we've gotten at this point. I don't know all the science behind it. The World Health Organization, they had that 72 mark The CDC has 7 days for your building. I don't know, there's different surfaces. I can't really define, why that's what the disparity is there.
Casey, this is Rebecca. I just want to
Yeah.
chime in here and note that it's really important for everyone to understand that Mid-Hudson is in no way presenting ourselves as public health officials. What we've done our best. Provide
Hey, Rebecca, we lost you. All right. Rebecca, okay. So that's a good point, Rebecca, as we've put together the information for you, and you can make the decision based on the information that we put together. Kirsten, was there anything else that you saw jumping out here on the chat that you thought we should address?
At our last portion, I think you had touched on who essential visitors actually would be. Would it be cleaning personnel? And you had mentioned UPS if it's your regular UPS delivery person.
Okay. So I think that, you can err on the side of caution there. I think if you have a cleaning person, yeah, you're going to want to know some contact info for that person and log when they've been to the building.
Krista is asking about if they should be logging patrons, because don't they have to be notified if a staff member gets sick after interacting with them?
Based on the guidance, you would not log patrons, and generally logging patron info is not a great idea. It's also potentially illegal. So patrons could sign up for the log voluntarily, and then you could notify them if you believe that they did have contact with staff. But a patron would be considered a customer, I believe, and so I don't think you would log a patron.
Carol is asking if staff who work with a symptomatic person need to self-quarantine as well.
Yes, we're looking at the proactive infection plan, and I'll get back to you with an answer on that.
And we do have one more question from Liz about the cleaning products, and that does it have to be the cleaners that are specifically on that official list from the CDC?
I have to double check the documentation from the New York State guidance, but they did mention the lists that are on that list N, which is the list of products that are known to kill COVID-19 and the coronavirus, or not known, but are believed to, according to the EPA, I think. Yes, the EPA.
Okay, I think we're all caught up unless anyone has some new questions.
Okay. Okay. If there's no other questions, I guess we can wrap it up. I appreciate everybody coming out today. If you have any other questions, you can contact us at Mid-Hudson. I'm happy to help. I appreciate everybody coming out today. Thank you again, and have a good day. Have a good weekend. Stay safe. Tammy, this document will be up on the COVID-19 page at some point.